Hi there, my name's Dr Phil Mitchelmore. I'm a lung doctor in Exeter, and I also work at the university where I do research. I'm particularly interested in infections in people's lungs. You kids have sent in some really great questions, and over the next few videos we'll try and answer some of those with regards to coronavirus. So first of all, we've got Tanisha and Olivia, who are in year 9, who have asked really excellent question about whether or not the vaccines will work against the new COVID-19 variants. So that's really, really great question and really important. What we know from some of the vaccines that are in use at the minute is that they do seem to be effective against the new variants, though there's some suggestion that possibly not quite as good as they are against the old variants. It's well known that viruses do change all the time, really, and mutations will happen. An example of this is the flu, which mutates more than coronavirus. And some of you may remember getting the spray up your nose for your flu vaccine, and that one can be tinkered and changed each year. And if needs be, the coronavirus vaccines will be able to do the same. So, in answer to your question, yes, they do seem to work against the new variants at the minute, possibly not quite as well, but if needs be, vaccines can be changed to take into account new variants. So, Lacey Rose, who's aged 8, wants to know how we know if the vaccine's going to work. So that's really great and really important question. So the way this is done is through what we call clinical trials, and essentially you get volunteers to participate in the study, and then without them knowing which one they're getting, they get randomly chosen to either get the real vaccine or a pretend one, and the people giving it don't know, and the volunteers receiving it don't know, but there's special codes on in the background, so it can be revealed who has had what. And then we wait and see what happens and see if people then develop symptoms or get coronavirus. And then once we've got enough people involved, we can then look and see who got the real one and who got the vaccine, and then see if it worked. One of the studies that's been done has been done down here in Exeter, where over 500 local people came along to the Nightingale Hospital to take part in the study. It was fantastic to get those volunteers, and the initial results show that the vaccines seem to be very good. So that was really great that we were able to do that down in Exeter. Ella and Eva, who are in year 9, want to know about how long the vaccine can be kept out of the fridge and how it's transported. So you may have heard a bit of that on the news and people talking about really cold temperatures and cold fridges and freezers and all of that. So different vaccines have different requirements. Some of them, like the Oxford vaccine, just need to be kept cool, so like in a fridge between about 2 and 8 degrees. The Pfizer vaccine, which is the first vaccine that was used in the UK, that's stored at a much colder temperature, so minus 70 degrees Celsius, so really, really cold. With regards to how they get transported, it's mainly been with insulated shippers, what's used to move the vaccines around. And obviously, depending on the vaccine, depends what needs to be in those containers to keep the vaccine cold. But for the ultra cold one, they've got dry ice inside those, which keeps the vaccine nice and cold as it needs to be. On these containers, they have these temperature monitoring devices. So when the vaccine arrives, we can check to see that it hasn't got too warm on its journey. With regards to how long you've got to use it after coming out of a fridge or freezer, so that again can vary between the vaccines. But for those that are kept in the fridge, you may be looking at sort of 3 to 6 hours. The one that's kept in the ultra cold freezer, though, can be longer, can be days. So thanks very much for those questions. I hope those answers make sense. Take care.